Hello, and welcome. Welcome, everyone. Thank you so much for joining us today. Welcome to I'm going to get started. And as people come in, I'm going to let them in. Just a few housekeeping things. Please make sure to mute your audio. And that's pretty much about it. And you can save all your questions. You can put your questions as I keep talking and going through the presentation. Feel free to add your questions on chat, and I will get to them by the end of the webinar. All right. So welcome to our pelvic health webinar series that we host here at Centrality Physical Therapy and Wellness on a monthly basis. And today we're going to talk about vulvodynia and vaginismus, right? So these are two very common conditions, and they're just not very much talked about being so common. And these conditions are known to affect or impact the quality of life. Yet so many individuals struggle in silence, maybe due to lack of awareness, maybe due to stigma, or just misdiagnosis. So a little bit about me. I am Sheron. My name is Sheron Dsouza. I'm a pelvic health physical therapist and at Centrality Physical Therapy and Wellness, and the director at our New Canaan location. And I do specialize in pregnancy and postpartum corrective exercise. However, I do treat all adults. So if you have a pelvis and you're an adult, I can treat you. All right. So moving on to objectives. My objectives and goals for today's webinar is, one, to increase awareness about these two conditions that often go unrecognized and under-recognized and misunderstood. I would also love to shed light on these conditions to provide insights into their potential causes, symptoms, as well as some treatment options. I would also love to educate you on the role of pelvic health physical therapy in the management of these conditions. And lastly, to empower individuals, so all of you, to take an active role in your own pelvic health to be able to effectively advocate for yourselves and navigate this healthcare system. So we get this question a lot, like, who is a healthcare provider? What do we do? And as I go through the webinar, you will understand more of what pelvic health physical therapy entails. But a pelvic health provider is a healthcare professional who specializes in diagnosing and treating conditions that affect the pelvic region. Pelvic health medical providers, they would include your OBGYNs, your urologists, your colorectal surgeons, your proctologists, as well as some pelvic pain management specialists. Now, your pelvic health rehabilitation providers include your physical therapists and your occupational therapists. All right, so before we go into what vulvodynia and vaginismus are, it's important to understand the anatomy, right? So what is the vulva? The vulva is not the vagina, right? So vulva is an external part of the female genitalia. So it can also vary greatly in appearance from person to person in terms of size, color, shape of its structures, right? And factors like age, hormonal changes, childbirth, and also some other experiences can influence its appearance. Now, if you look at the illustration on the right, here we have the picture of a vulva, and the person is laying on their back, right? The person's laying on their back, so their pubic bone is right on the top, right here. And then if I can put my cursor, I hope you can see that. We start at the clitoral hood right on top. Here is the clitoris. Then along the outside of the vulva is your labia majora. Then on the inside is your labia minora. On top, you have over here is your urethral meatus, so your opening to your urethra. And over here is your introitus, so your vaginal opening. And vestibule. The vestibule is all this area that's surrounding the urethral meatus as well as the introitus. This is going to be important to know when we talk about vestibulodynia, which is the most common form of vulvodynia. And right at the bottom here, we have your perineum and your anus, just for reference. All right, so what is vulvodynia? Vulvodynia is a chronic pain in the vulva that lasts for about more than 3 months, without a clear cause though. And there are a few types of vulvodynia. So we have localized, where pain in one specific area of the vulva, and that's often the provoked vestibulodynia. And this pain can be triggered by activities like sexual intercourse, tampon insertion, or even prolonged sitting. And as I've mentioned before, vestibulodynia is the most common. The generalized vulvodynia is pain that occurs spontaneously and can be constant or intermittent. And this can affect different areas of the vulva at different times. It could also be provoked or unprovoked. And we will go a little bit into this on an upcoming slide, but provoked is basically when there is direct pressure on the vulva, and that's what triggers your symptoms. And unprovoked is when, regardless, there's no pressure, direct pressure on the vulva, and you still experience those symptoms. So what are the causes of vulvodynia? Unfortunately, the exact cause of vulvodynia remains unknown, but several factors could contribute to the development of vulvodynia. So some of them are nerve injury or irritation. And, yes. So some of them are nerve injury or irritation. So if there is any increased nerve endings in the vulva, maybe due to inflammation, due to infection, these can be something that triggers the symptoms of vulvodynia. You can have an infection or even trauma. Genetic factors. So genetic factors means that some individuals, not all individuals will have vulvodynia, but some individuals do, and they do experience this at a very young age. So maybe the first time they have a sexual intercourse, or the first time they're trying to insert a tampon, that's what they feel, they have vulvodynia, or they feel pain. Hormonal changes. This is actually very important because hormonal changes can take place when you're on oral contraceptives, if you're breastfeeding, as well as during postmenopause. Again, not everybody on oral contraceptives would develop vulvodynia, but some can experience symptoms of vulvodynia depending on their hormonal insufficiencies. So another reason or another cause of vulvodynia is pelvic floor muscle spasm or weakness. This could be from any other conditions, like any other pelvic floor dysfunction or anything that's affecting the pelvic organs, which is either your uterus, your bladder, or your rectum. And that can cause a lot of pelvic floor muscle spasms, tension, or weakness. And this could also give rise to vulvodynia, which goes to say that vulvodynia doesn't need to be it can be associated and can be present with other conditions in the pelvic floor. And in the end, it's inflammation of these tissues, right? So with inflammation, there's increased cytokines in the vulva area that causes a lot of increased sensitivity and pain in that area. So going back to hormonal changes, if just to give a little bit of some information as to how oral contraceptives would or can give rise to vulvodynia, is because of hormonal insufficiencies. So oral contraceptives, some of them, they reduce your estrogen levels and even testosterone levels, and that makes the tissues very sensitive. And the vestibule that we looked at before, the vestibule actually runs on estrogen and testosterone for lubrication. So if that's not available to that tissue, it tends to get more sensitive, and that can give rise to symptoms of vulvodynia. Similarly, even in breastfeeding, early postpartum, estrogen levels are very low, tissues are very sensitive at this time, and this can give rise to vulvodynia.
Thank you.
Along with postmenopausal.
Amazon.
Along with postmenopausal period of life, that's again another time when our estrogen, there is a lot of hormonal insufficiencies and our estrogen levels are pretty low, and again give rise to symptoms of vulvodynia. So what are the symptoms of vulvodynia? They can come in as burning, stinging, rawness, rarely itching, throbbing, and soreness. Now, what can provoke the pain, right? So we talked about provoked as well as unprovoked vulvodynia. Provoked vulvodynia is pain by touch or pressure, which can arise by sexual intercourse, tampon insertion, prolonged sitting, also wearing some tight-fitting pants or underwear. And unprovoked is spontaneous pain without any apparent trigger. The prevalence of vulvodynia. So studies have shown that at least 1 in 6 women may experience symptoms of vulvodynia at some point in their life. And this is something to note. Like, women saw an average of 4 healthcare providers before receiving a diagnosis of vulvodynia. And on an average, approximately 4.5 years from it took 4.5 years from the onset of symptoms to obtain an actual diagnosis. And this is heartbreaking, because this being such a common condition and having to navigate through so many healthcare providers to get an accurate diagnosis is something that's why we're hosting this webinar. That's why we're trying to build and increase awareness, build on understanding all this information, so you are well equipped to be able to find the right providers and also ask your providers the questions that you need to. Now, there's also a high prevalence of pelvic floor dysfunction in women with provoked vestibulodynia. So as I said, provoked vestibulodynia is when there is pressure in the vulva area, right? Even though there's a high prevalence of pelvic floor dysfunction, it still does mean that not everybody with pelvic floor dysfunction will have vestibulodynia, and not everybody with vestibulodynia will have pelvic floor dysfunction. But most likely than not, they would have some of it, especially if it's taking 4.5 years to about diagnose them. More than likely, there would be some sort of pelvic floor dysfunction associated with vulvodynia. And how is the diagnosis made, right? So the diagnosis of vulvodynia can only be made by a vulva specialist. However, pelvic health therapists can assist in taking a detailed history intake. So that would include understanding your symptoms. How did it begin? What are the relieving factors? What are the aggravating factors, right? Getting a good medical history, understanding your medications. That's another important thing. So all of this detailed history intake is very important in understanding or in helping us diagnose vulvodynia. Then we move on to visual examination, looking at the skin, looking for changes, looking for any signs of inflammation or infection. We can also do a Q-tip test. A Q-tip test is when we use a Q-tip around the vulva. So if you think of a clock, right? So at 12, 2, 4, 8, and 10, the provider can gently apply pressure to these points in the vulva. And for people that have vulvodynia, it is excruciatingly painful. And for people that don't, you will feel some pressure. Now, we can also do an internal pelvic floor exam, but always with your informed consent. If you do not want to have that done during that session, that is absolutely going to be respected, and there are other things that your provider can do. And also an external pelvic floor exam as well. And then your medical provider will be also able to rule out other medical conditions that could be causing or contributing to these symptoms. So treatment of vulvodynia, it's very important, and I cannot stress this enough. A multidisciplinary model is the most effective. Not any one treatment option will be the only thing that you would do to treat vulvodynia. Studies have shown a high level of success with pelvic floor physical therapy in conjunction with other treatments. So we can go on with topical or oral medications. They help to alter nerve firing. So when there is a lot of nerve sensitivity in that area, these medications would be very helpful. Topical hormones. So if there is any hormonal insufficiency, topical hormones will be very beneficial for these patients. And cognitive behavioral therapy. This is a mindfulness approach, which is very important to address challenges of, self-esteem, low self-esteem, confidence levels, low self-worth. These are feelings that are very commonly associated with vulvodynia or other forms of pain with sex. And getting counseling for this is going to be very, very helpful and a great adjunct to the physical therapy and the other medications. And vulva hygiene. Vulva hygiene is basically removing any potential irritants. So soaps, any laundry detergents, fabric softeners, tight pants or underwear. And you might be thinking that you've been using either a soap or a detergent for a while and you have been fine, and then the symptoms just came on. It can be that throughout the years, the sensitivity increased. So maybe that you were using something before was fine, but now it's not. And with clothing, changing to cotton, that is much more gentle in that area compared to other materials. And lastly, surgery. Surgery is when all modes of treatment are still not giving the relief. That's when surgery will be considered. Now, I'd just like to spend a little bit of time talking about how pelvic floor PT, what pelvic floor PT does for vulvodynia. So one, we address the musculoskeletal as well as the neuromuscular impairments, which means improving muscle strength, length, joint mobility, addressing any neural restrictions. We also work with a lot of pain desensitization techniques. We look at manual therapy. We work with manual therapy, so lots of hands-on treatment, so myofascial release, soft tissue mobilization to decrease muscle tension as well as reduce pain. And then internal vaginal or rectal pelvic floor muscle manual therapy. Again, this is done only with your consent. And the reason I've put in rectal treatment is because sometimes doing internal is just so uncomfortable and painful, and we don't want to upregulate and irritate an already irritated area if it's just too much. So we can access those same group of muscles, albeit posteriorly, through the rectum. And sometimes that has shown to be very effective in helping reduce tension anteriorly, that is in the vaginal area. So you can always talk to your physical therapist about this. And pelvic floor, the continuing pelvic floor PT for vulvodynia, continuing. So education, very important part of our session. We love to give a lot of education, helping you understand what the pelvis is, what the pelvic floor looks like, what are the other muscles that are surrounding the pelvis. and how they can impact your pelvic floor. It is so important. And it is also so empowering to understand, to be able to understand what's going on and getting answers to what you're struggling from. We provide you with a home exercise program. We also talk about behavioral techniques, which therapists can provide guidance on modifying activities or habits that may exacerbate the symptoms. This can include advice on posture, voiding habits, and even some sexual activity. And lastly, multimodal approach. Working in tandem with other healthcare providers is always the best. Now moving on to vaginismus. So vaginismus is an involuntary contraction of the pelvic floor muscles that can cause pain, discomfort, and difficulty or inability to have intercourse, or insert tampons or undergo a pelvic exam. So basically, this involuntary contraction of the pelvic floor muscles, they make it hard to achieve penetration, right? So if you look at the illustration on the right, this is a diagram of the third layer of the pelvic floor, the deepest layer of the pelvic floor. So if this is your pubic bone right at the bottom here and their tailbone right at the top, you will going from bottom to top. Here you have your urethra. This is your vagina and your anus. So if you can see how closely all these pelvic floor muscles, how intricately they are associated with the vagina. So any dysfunction or any pain in the or attempt of penetration in this area can affect these muscles and cause that contraction. So vaginismus, there are two types. We have primary vaginismus and secondary vaginismus. Primary is when the woman has never been able to have penetrative sex or insert tampons without pain. And secondary could be developed after a period of pain-free intercourse or tampon use, so often following events like childbirth or surgery or even menopause. And vaginismus is believed to affect anywhere from 1 to 17% of the female population. But it can be underreported. So this number could be this percentage could be higher, but it goes underreported because of either embarrassment or also lack of awareness. And just something to note that vaginismus can place stress on intimate relationships, impede your ability to conceive, and also lead to very heightened anxiety. The causes of vaginismus. The causes are a combination of, it could be one or a combination of physical as well as psychological factors. So that would include your past trauma, fear of pain, childbirth, cultural beliefs. So there are some cultures and religious beliefs where sex is a very taboo topic. And in those people, we do see a high incidence of vaginismus. And then we also move on to pelvic surgeries. Now, symptoms of vaginismus, we have difficulty or inability to achieve vaginal penetration, pain or burning during intercourse or insertion, a ripping or tearing-like sensation with penetration, fear of penetration, difficulty with pelvic exams, a feeling of tightness. So we hear this commonly, feels like my partner is hitting a wall, feels like I don't have a hole, just because of the intensity of how tight those muscles contract. So again, just like vulvodynia, treatment of vaginismus is by using a very multidisciplinary approach. So pelvic floor physical therapy, medications for relaxation, as well as counseling from a sex therapist or a psychologist. So very similar to vulvodynia, but also different, right? So understanding the differences of treatment of what you are experiencing, it helps guide our treatment. So for vaginismus, we are going to really focus on muscle relaxation. So lots of exercises and techniques to learn how to relax and control these muscles to be able to facilitate easier as well as less painful penetration. Manual therapy, so myofascial release, soft tissue mobilization, again, to relieve that muscle tension, to relieve some spasm in the pelvic floor. Dilators and pelvic wands. So dilators are a very important part of treating vaginismus. There is, under the guidance of a therapist, of a physical therapist, you can use vaginal dilators of increasing size and until the patient, for the patient to comfortably stretch and accommodate the vaginal tissues, and helping them become more accustomed to penetration. Education, just like I mentioned before, understanding the anatomy and the function of the pelvic floor, as well as the nature of vaginismus, can be very empowering for patients. It provides a clear pathway to treatment. Continuing on the treatment, we have breathing exercises. This is something that we normally start our sessions with, just understanding the mechanics of how the diaphragm and the pelvic floor work together, and understanding how to relax the pelvic floor using breath. So we breathe about 20,000 times a day on average. So really learning how to use that to be able to relax your pelvic floor muscles is extremely beneficial. We also talked about pain sensitization techniques to decrease pain and also the pain experienced during attempted penetration. Then we provide a home exercise program, as well as other behavioral techniques that can also address behaviors, as well as thought patterns that may be contributing to or even exacerbating vaginismus, and which might include some visualization exercises, as well as relaxation techniques, as well as some guidance on pacing. So the bottom line of today's talk is your pain is real and valid. It's not all in your head. You do not need to drink a glass of wine to relax and be able to have sex. You do not have to live with this. You can be helped, right? And working with a team of healthcare providers is key. So as we discussed, your GYN, your vulva specialist, a urologist, a pelvic health therapist, and a psychologist, right? So in combination, this would be really, really beneficial. We do get this question a lot. How do we find a pelvic floor therapist? So here we've listed 3 easy search engines where you can look for a pelvic health therapist in your area. And you can, here we've placed a QR code. If you would like to come see us in Connecticut at Centrality Physical Therapy and Wellness, you get a 10% off your session, one of your sessions, and you can book this either using the QR code, or you can give a call to our office, or even email us at hello@centralitywellness.com. And if you'd like to know more about pelvic health and understand more, we do, you can follow us on Instagram. We do post a lot of educational content on there. And our next exciting webinar is on November 14th, and that's going to be with Dr. Jen Morgan and our special guest, Ashley Minihan, and they're going to talk about doula support and pelvic rehab. This is going to be a very exciting topic. So be sure to sign up. And I would just like to say a big thank you for attending, and I am open to any questions. All right. Okay, so a couple of questions. I feel that I have both vulvodynia and vaginismus. Is this possible? Yes, it is absolutely possible. Understanding, that's why history taking is so important, right? Vulvodynia could be caused either because of certain medications that you've been having. Maybe you were being treated for acne. Maybe you started taking oral contraceptives because of very painful periods when you were younger. Maybe you're taking oral contraceptives right now and you're having those symptoms of vulvodynia because of decreased estrogen. However, because, as I've mentioned before, that because it takes so long to get diagnosed, it can also transmit to a lot of pelvic floor dysfunction and tightening of this area. Because there's a lot of muscle guarding. When there's pain in an area, your body wants to tighten up to guard that area to protect you from experiencing any more pain. So with the presence of vulvodynia, you would abstain from any sort of penetration, right? And then mentally, there's also that fear of pain, which does affect how the pelvic floor muscles respond to either that anticipation of penetration or just even sometimes even thinking about it. So the muscles are always clenched and guarded. So yes, you can absolutely have a combination of both vulvodynia as well as vaginismus. All right, so can these symptoms come on later in life? I feel like this was not an issue until about 5 years ago. 100%. Yes, these symptoms can come on at any time. So later in life, if you're, say, postmenopausal, right, you can absolutely have lots of hormonal insufficiencies that can give rise to very irritated, very sensitive vulva, and cause symptoms of vulvodynia. And even with vaginismus, as I've discussed before, vaginismus can go hand in hand with vulvodynia. So you want to feel for the integrity of your pelvic floor and the surrounding muscles. So symptoms can appear later on in life. And say, for example, like we talked about secondary vaginismus, in terms of vaginismus, secondary vaginismus can occur post a certain event. Like it could be trauma. It could be, childbirth, it could be any surgery that you've had in that area. So that also could give rise to a lot of pelvic muscle guarding. All right, so this is a great question. If I have vaginismus and seek out pelvic floor physical therapy, how would treatment look like if I decline an internal assessment and treatment? I just do not feel comfortable with that. And if the internal is mandatory, I may decline PT altogether. Great question. And yes, while internal examination and treatment can give us a lot of information, we don't have to start there. We can do so many things externally, right? So we talked about how educating on the different muscles that are attached to the pelvis and how everything is connected. So we will look at your movement. We will look at your hip range of motion. We will look at your abdominal strength. We would look at how your core is functioning. We would look at how well you're breathing. Is all your breathing happening right here? Is your system very upregulated? We'll give you techniques to work on calming and down regulating your nervous system, and we'll take it step by step from there. And if that's internal is something that you are not wanting to do at all, that's absolutely fine, right? Externally, there are so many muscles that are connected right into that area and share common fascial connections. So working on those connections, working on muscles that are surrounding the pelvis can also provide a lot of relief from these symptoms. Okay. I think that's it for now. So if we don't have any more questions, I think I will stop there. And thank you so much for joining me. And if you're seeing this on the recording, I appreciate you for your time. All right. Have a good night.